An alarming survey carried out for ITV News has revealed how junior doctors are struggling to cope with rising pressure and stress badly affecting their mental health. They're currently being balloted for strike action in England, with better working conditions one of the key concerns. Many say the situation in the NHS is now worse than it was during the pandemic. And unless things improve, some are considering moving abroad or even quitting the profession. Martin Stew heard from 3 doctors about the terrible impact of their work on their mental well-being, and a warning that his special report contains details of how some doctors have even thought of suicide.
I simply cannot do this anymore.
Abused and exhausted.
On the way to a major breakdown.
The voices of junior doctors on the brink.
I felt so low after work that life isn't worth living.
The job of making us physically better,
burned out, demoralised,
is making many mentally unwell.
I often feel suicidal.
Being dead is preferable to being bullied by my racist, sexist colleagues.
These comments from 265 junior doctors who responded to a survey Charity Duty to Care carried out on our behalf. 91% of respondents said the job was damaging their mental health. 89% of them are considering quitting.
I've cried before a shift, I've cried during a shift and cried after a shift.
Sumi is in her 2nd year as a junior doctor. She's struggling to cope.
It manifests for me as burnout. I feel like I can't go on anymore. I'm not interested in anything. I've lost interest in work, talking to my friends, my family, or anything that I've lost all joy from my life.
We asked her to make a video diary of a normal night shift.
They were a doctor down last night, so I'm worried if that's going to be the case today.
According to the British Medical Association, there are 9,000 vacancies for doctors, putting added pressure on those on shift.
It's about 2 a.m. now. Like I predicted, when I came in, there was a little bit of a backlog to clear. Unfortunately, we don't have any. Oh, there goes my bleep. The time is now 5 a.m. Developed a little bit of a headache, probably due to lack of water on this shift. So I'm going to go have a drink and hopefully that will sort things out.
3 years ago, anaesthetist Charlie Hunt was finding it impossible to leave work at the front door. Struggling to be there mentally for his young kids, he turned to online counselling.
What I want you to do then, Charlie, is just relax.
Realising others would benefit from similar help, he and his wife set up a charity. Today, they've never been busier.
So, Charlie, how are you?
I'm all right, yeah.
Still getting support?
Yeah, I get support through Duty to Care, the charity I set up with my wife. Try to maintain it as much as I can, just to keep the demons away.
How's the level of demand now? Has it dropped off now the pandemic's finished?
We thought it would do, but we've actually seen a spike in interest.
In fact, more than half said 2022 had been worse than either of the COVID years.
How close did you come to taking your own life?
I was on a platform looking at train tracks. The only thing which stopped me was seeing a family of foxes through the fence.
Surinder walked away from the job he'd always wanted to save himself.
Soul destroying. It really is soul destroying.
The moral burden of being unable to provide complete care as a result of an overstretched system, too much to bear.
If I can't do that, what am I? And I think it becomes that identity conflict. If I can't be the doctor, then I'm just useless. That breaks people. It broke me. It has sadly broken other people to the point where they're not here anymore.
Do you think that will continue if nothing changes?
Yes.
The government says supporting and retaining NHS staff is one of its top priorities. £45 million has been invested in mental health hubs, and that there are nearly 5,000 more doctors than last year. Surinder is now writing a textbook, or perhaps more accurately, a survival guide.
You've got to be responsible for yourself if you want to be responsible remotely for anyone else. And that's not being selfish, it's being prudent, it's being wise.
It's just gone 11 a.m.
Back in London, Sumi's returned from her night shift.
I probably won't be asleep till 12, knowing that I've got to get up at 5:30, do it all over again for the next set of nights is difficult.
2 close colleagues have quit to emigrate to Australia in the last month. Sumi is seriously considering joining them.
if we don't do something about this, I'm either going to leave the profession, I'm going to end up in a worse place than I am at the moment, or I'm just going to go abroad.
Voting to strike later this year is another thing to weigh on her conscience, but she says industrial action is the only hope of saving the NHS. Martin Stew, ITV News.